Good afternoon and welcome to the Weekend Wellness Hour. Today, we are going to cover sleep and hormones and a lot of other things regarding sleep with Dr. Carol Yuan. She joins us today. She is a board certified physician in pulmonary, critical care, internal medicine, and sleep. So she is a wealth of knowledge. So we're going to tap into that today, and very honored to have her here with us to share with us amazing information about sleep and hormones and what we can do about it. So thank you so much, Dr. Yuan, for joining us today.
Thank you, Amy, for having me. I'm so excited to be here.
That's wonderful. So how did you get into the world of sleep? And you have many different interests, obviously, in medicine. So how did you get into sleep?
I've been a sleep doctor for 10 years. And so when it first started 10 years ago, sleep was still relatively a new field in terms of for a doctor seeing patients for their sleep issues. The sleep field itself has been around for probably about 40 years, but mostly in the research realm. Mm-hmm. So when I first got into it, I was actually the first batch of doctors who were required to have specifically a 1 year of fellowship training to be able to become board eligible, then taking the boards and board certified. So it was very exciting. And as opposed to my other fields, which I'm also a pulmonary doctor, so the lungs, a critical care doctor, which is seeing the very sick patients in the ICU. Sleep is the opposite of that, where it's not a specific organ. So it's kind of mysterious, if not a little bit elusive. Mm-hmm. And it's just the pace is very different from critical care. And what I found was all my patients, whether they see me for lung issues or those I see in the ICU, it seems like all the problems are linked, associated with sleep, meaning that because of the problems they have, it can affect their sleep, or they have problems because they're not sleeping well. So, sleep was very interesting to me in that way. And, that's why I got into it. And that's why I'm still very passionate about it today.
That makes sense. And I like how you talk about there's not really an organ that you're addressing with sleep. There's so much that goes in to play with it. And I know that we've been talking offline a little bit about hormones, specifically reproductive hormones and sleep. And you had mentioned how that really affects, especially for women, we have those hormonal changes throughout our life and even on a monthly basis, and how that impacts sleep. So can you dive into a little bit about hormones and sleep, and what are some of the impacts, and just in a general sense as we kind of move through, different periods of life for a woman?
Sure. Yeah. So women have unique challenges when it comes to sleep, and hormones being a big part of that, because we go across our lifespan, there's major hormonal transitions. Puberty, with the start of menstruation, pregnancy, menopause. These are major milestones, transition that it changes, disrupts everything. Maybe disrupts is not quite the right word. Just renew. It signifies the body moving forward onto transitioning to the next phase. And during each of this transition, sleep is affected. So across a woman's lifespan, there is a higher risk of just having sleep issues. One of the big reasons being our hormones. And so, and all this starts very early. So research studies actually show that starting in teenage years, teenage girls seems to be affected more by sleep issues, meaning having the same sleep disruption, teenage girls seems to have more symptoms of it. They tend to feel more tired, and that impact their day-to-day life more. And also, I mean, we all have experienced PMS symptoms to some degree. Not all of us might not be the same. Some may be more of a irritability, bloating, or skin changes. Sleep is very much a big part of that too. Oftentimes, before we get our period, people feel that they're more tired. They wake up more at night, and so that's related to the hormonal changes. Yeah. Then menopause. This is well documented, where the transitional period, so perimenopause, which means for most women starting in the 40s, sleep becomes disrupted. We wake up more for reasons like hot flashes, night sweats, going to the bathroom, and that extends through the postmenopausal period. So for some women, that is a 10, 20-year ordeal. Their sleep interrupted by hormonal changes. And not to mention the in-between, the pregnancy part, where that's another time where women have their hormones, the environment completely changed upside down. And so not only during the pregnancy period, sleep becomes interrupted, but afterwards, being a new mom, taking care of baby, waking up at night, nursing, all of that affects women's sleep as well. So yeah, so sleep and hormone really is tightly connected. I compare it to like class fingers, where you can't tease out which one is causing the other. Is it the hormones causing the sleep problems, or is it then the sleep problems affecting our hormones? It's hard to figure out which was the chicken, which egg. So but it's just that acknowledging that the interconnection, I think it's a big step towards us figuring out how to get better sleep.
That's interesting. And do we know which specific hormone is impacting, like is it estrogen or progesterone? Do we have any kind of trends or any ideas if one is affecting us more than the other, or both, or testosterone?
Yeah, so the answer is all of them can affect sleep to a different degree. So if we, for example, progesterone, we know that on its own, it makes people sleepier. Mm-hmm. And testosterone itself potentially can lower our arousal threshold, which means that it could make us wake up more. A lot of times, though, I think more than just specifically what each hormone does is that the changing of it, the levels suddenly going up, suddenly dropping off, the changing of it itself, that's interrupting sleep.
Okay, so with monthly cycles, we have this change, and so that's when it can really impact our sleep. I can imagine that. Okay.
Right.
So because women have a greater change, do you typically associate hormone and sleep issues more with women than with men, or do men have their own slew of sleep issues related to hormones?
Yeah, so what takes sleep apnea, for example. So in men, sleep apnea can affect testosterone level. It causes lower testosterone. And on the other hand, we also know that replacing testosterone, so that the higher levels of testosterone itself can make sleep apnea worse.
Oh.
Yeah.
Wow, so sleep apnea causes lower testosterone, but if you supplement with higher testosterone, it increases sleep apnea.
Right.
Wow.
So I often get patients referred from endocrinologists, patients who have low testosterone level, that their doctors, before giving them a replacement, they want them to get checked out for sleep apnea first, because it might be fixing the root cause if they do have sleep apnea, and that's why they have low testosterone level. And the other reason is they want to make sure that they're being treated safely, that they don't get untreated sleep apnea because of going on testosterone.
Wow, that's really nice that the endocrinologists are aware of this and are making sure they don't just over medicate someone and send them on the wrong path. So now when you're talking about for women, we're going to jump back to women, when it's something like a menstrual cycle, so it's a monthly basis, and this is something that happens for many years out of a woman's life. What are some things that we can do to help combat some of the changes in the, sleep and any disturbances, especially if you're in a certain stage of the cycle that happens every month?
Yeah. So the best way, I think, is to figure out, to get what I always tell people is to know your sleep. What is the problem? And is that, so when we say, I can't sleep, I don't sleep well. Well, are you having problem falling asleep? Is it you're waking up at night and you can't go back to sleep? Or you're waking up too early? And different problems would require different treatments.
Okay.
So that's step number one. And number two is we know that a lot of times that the fixes for issues are maybe solutions that we've heard a lot. And so they become a little cliched, or we just forgot about them. And but in terms of hormonal changes and affecting sleep, how we can counteract that. Simple things like, and if for someone who's not already active, but make sure that you get sunlight every day, being outside, doing regular exercise, physical activity. That itself affect our overall balance and function of our hormones. And so during period of more difficult times, we just have to be a little bit more vigilant about doing the quote unquote right things. And so another same thing is, so going to bed and getting up. So with our sleep schedule, we all we can slack off now and then, staying up to watch TV or sleeping in late on weekends. But during the time when we expect more sleep issues, that may be the time where we have to be a little bit more disciplined to maintain our sleep quality.
Okay, so kind of if you're going through a hormonal change, try to be a little bit more consistent on bedtime and wake up time. And is there a recommendation that you shouldn't skew past, half hour of going to bed at a certain time or an hour of wake up time? Is there a good recommendation on that?
So again, the recommendation would be going back and knowing your own sleep schedule.
Okay.
And when we all have different circadian rhythms, so our body preferred bed and wake time are slightly different. And the ideal would be not to skew from that for more than 30 minutes.
Okay, so that's great. That's great to know. And then as far as sunshine, you mentioned that, is that better to get early in the day, or does it matter if you get sunshine any time of the day?
So definitely earlier in the day would be better, because that's can reinforce our circadian rhythm. Otherwise, for some people who are more sensitive, sunshine is a little bit like caffeine. We all have different tolerance. Some people may be able to get sunlight a little bit later in the day and not affect their nighttime sleep. Other people, the effect of getting sunlight too late may be that it would stimulate them and make it harder for them to fall asleep.
Okay.
So it's something that we can play around with and find what's the best time for each of us.
That's great. And so it sounds like we have all these individual differences, but because you have this knowledge of all the different ways to help people sleep, you can tailor it to a person's lifestyle, hormones, and other factors that go into it.
Absolutely. Yeah. That is really what I believe is the best way, especially for women when we are faced with so many different challenges, is to find a strategy that is based on your own biology and tailor it to your life stages, lifestyle, goals, and priorities.
That's a great idea. And then as regards to hormone replacement or birth control, if a woman is going through severe menstrual cycles and they're taking birth control, or if someone's past menopause or doing a hormone replacement, are those medications also used to help regulate sleep, or do they impact sleep as well? What's the relationship?
Absolutely. What I see and what the studies show is definitely for women who have severe symptoms from these hormonal changes, then hormone replacement therapy definitely helps with their sleep, for sure.
Okay. And same with birth control as well, or is there any relationship with birth control?
Well, I think it's birth control if it's taken for the purpose of regulating the hormonal cycles, reducing PMS symptoms, then it will help with sleep too. For somebody who is going on birth control for contraceptive reasons, then it's hard to predict how their sleep might react to the medication.
Okay. So it's a matter of kind of looking at what the hormones are doing, and if they're being regulated, then that influences sleep.
Yes.
And do we know with reproductive hormones like this, does it affect certain stages of the sleep cycle, like non-REM versus REM sleep? Is that teased apart yet, or not really in the research?
I would say I'm not familiar with that. There may be some basic science research that indicate one way or the other. But I would say that in general, when sleep is improved, that itself would equal out or balance out the distortion of our sleep architecture formed from poor sleep. So a lot of times with these research, it's hard to say that the change in sleep stage, is it because the person is just getting better sleep, or is it the medication that's specifically itself acting on that stage?
Got it. And then, so I'm curious, even as we talk about medication now, what about some of the sleep aids, kind of like Ambien and some others? So obviously people take them to help them sleep, but I've heard various, rumors, or I don't know if they're fact, of they're not really helping you. And of course we want to try more natural methods, but have you seen, what can you tell us about Ambien, and how does that also impact our hormones too?
Yeah, so I look at sleep medication not as in itself bad or good, but it's just one of the tool in my toolbox.
Okay.
So again, it's fixing what the exact problem is, that the sleep problem is. What I disagree with how sleep medication is used is as a Band-Aid.
Okay.
That it's covering up the surface, our symptom. So I can't sleep, well, I'll give you a sleep medication to knock you out and fall asleep. but that may not be addressing why you can't sleep. And to me, it's more important that we figure out the root cause, address that, and afterwards, if there's still residual symptoms, then we can use sleep medication as a tool to smooth out that last bit of discomfort or irregularity, so that we get our best sleep.
Right. And then when you do use sleep medication as a tool, is there a weaning off process eventually to help you see, okay, you can come off a dosage or go down a dosage and see if your sleep can stay steady with the habit you've built?
Absolutely. Yeah. So it's a big topic that's often debated, how to use sleep medication for those people who need it. Should we use sleep medication like how we use medication for high blood pressure, for example, or low thyroid? It's just something, it's a medication that you take for a chronic medical problems. Or should we use it as an antibiotics? You take it as needed when there is a need for it. And I think you can find people arguing for each and then adamantly disagreeing with the other. But I think that the bottom line is we also, most of us do try sometimes to wean patients off it if possible. And that's a process that we monitor closely as well, because if someone who's been on medication for a while, you just stop the medication, they can have rebound, which is the symptoms that they were trying to treat before. All of a sudden, the medication is stopped, they become very severe. So the right way to do it is really a slow wean over time, close monitoring with the doctor.
Okay. Yeah. I mean, it's kind of scary to have those symptoms come back, and then you almost are afraid you become more dependent on the medication because
Yes.
it provided such a relief to you. So I can understand that. And then also, I imagine when stress is involved, you set off stress hormones, which also affect reproductive hormones, which also affect sleep. So you almost have this triangle web of each of both types of hormones affecting sleep and vice versa, correct?
Yes, yeah. Stress is a big topic. So like you said, stress itself can affect sleep. And when we don't sleep well or we're sleep deprived, that increases the stress hormone itself.
Mm-hmm.
And then the stress hormone itself can cause other medical issues, which then can come back and affect sleep. So again, it's this web of interconnection.
Yeah, it's hard to tease them apart, as you said. So it's almost like you have to try to hit everything all at once and address so many issues at once and see how someone's sleep improves.
Yeah. So yeah, I would say it's definitely trying to address all of it, which it's not always possible, but also it's just consistent and being patient. Allow time also to be part of that solution. Oftentimes we are very eager to see results, especially when we try anything new, forgetting that whatever we quote unquote try, it takes time, especially with sleep. When over time, sleep is, in a way, I compare it to kind of our finances. It builds up. So that means you can accumulate wealth, but you can also accumulate debt. And so anything that you do right at this moment, you are definitely resetting the trend from this point forward, but it takes a while to get that balance back.
And that makes sense, because we often hear people try something new and give it up after a couple days and say it didn't work. But just like I know there are certain medications that take a while to get into your body. There's when you're building a new habit, it takes a while to have a change. So I could see how we need to take some time for sleep as well.
Right.
To see where we're at. So when we think about some of the impacts of hormones on sleep and vice versa, obviously stress is part of that, but also diet can also be an influencer on both stress and hormones and sleep. So how does that play into it? Do you have some suggestions about that? Some things that people can take away?
Yeah. Diet, I think that my recommendation is probably a more basic recommendations. Regular diets in terms of a balanced nutrition. It may all sound cliche, but oftentimes I see how that is a main factor affecting sleep. And the timing of diet, because we know with the circadian rhythm, food is just as strong as a trigger to reset our internal clock like daylights. And so the timing of when you eat, especially dinner, can affect our sleep quality, affect how and when you are able to fall asleep. Yeah, so that those would be my touch on diets.
And so should we finish our dinner a couple hours before we go to sleep? Or is there any studies or recommendations that say there's an optimal time to eat versus when you go to sleep?
So yeah, so again, ideally the general recommendation is that your last meal should be no more than no less than 4 hours before going to bed.
Okay.
And another thing is not just the timing, but also the type of food. So heavy and spicy foods that may cause acid reflux, heartburn, those type of the food items we will want to avoid as well.
Okay, that's great advice. And are there other influences on sleep? I know sometimes women, if they're caregivers or taking care of children or a family or family members, sometimes you may be a little bit more on the stress mode, but also have some negative beliefs. Is that something that also impacts our sleep, or is there anything else related to that?
Oh yeah, that's a topic I'm very much interested in. Okay. And that's why I created the practice for women is just understanding or recognizing that the challenges posed on women because of the unequal burden of caring for the young, the old, and the sick in our society. And I think what that distills down to, what that does to women, is really, it takes time away from us. And women simply just don't have the time to sleep. And, and there's also what you said about the stress that created. So in our society today, women can't sleep and women won't sleep. We don't have the time, so we won't sleep. We want to finish this, finish that. We want to get up early so we can do this before the kids get up, before before the bus comes, and then our mind is still racing at night when we go to bed. So, and that makes it hard for us to fall asleep. So where sleep is very much squeezed down to the bare wire. And so what do we do? Mm-hmm. A lot of times you think about all these issues and the hormones and the stress. It's like it feels like it's a very helpless situation, and it is very complicated. So what I believe where we can start is going inside, inwards, and really again look into what is my biology, what is my circadian rhythm, what is my sleep need, the number of hours that my body needs every night to feel satisfied. Then at least now I have a goal. Knowing these two things, doesn't mean that then I'll be able to do that, because that is really the gap. Is we are, with all the things that we're dealing with, and this is our goal. It's hard for us to cross that chasm, but let's define our goal first. That way we have a goal to move toward, to something to look ahead, and use that as an assessment and as a monitor, to monitor our progress, and also to set our goal, to make our plan, to create a plan. And that's what I think that women needs.
And that's great, because if we can get our mind set on something, and it almost gives us hope, and we realize, okay, we have a guideline, we have a set steps to get to the next level where we want. It's really helpful for those of us who are caring for other people or have a lot going on in our lives. It's nice to have some direction to head towards.
Yeah, right.
Yeah, that's wonderful. So, and this has been very fascinating. Are there any other tidbits or anything that people should think about when it comes to hormones and sleep, whether it's any bit of advice, patience, anything like that?
Yeah, I think so what I want to reemphasize is to know your own sleep identity, and not feel that you have to follow all the sleep rules or tips that are being thrown at you on social media, because they are well-intentioned and there is nothing wrong with them, but they might not be right for you. And and have hope that no matter your situation, the things that you're dealing with, whether it's your physical health or at home or at work, you can get the best sleep where you are, at your age, with that circumstance. So do know that there is a better sleep. There is a way to feel more rested and have more energy.
That's wonderful. We appreciate it. And I know you also have a telehealth consultation business as well, to help women with sleep and improving, the relationship of their hormones to sleep. And so can you tell us a little bit about that? How can people reach you? All of that.
Yeah. So the service that I have, it's a telehealth consultation service for women. And my goal is to help women get their best sleep at any age. It's High Sleep Health. It was named after my daughter to represent the next generation of women. I believe women are the backbone of society. And when we all feel more rested, do well, then the whole society benefits. So yeah, please check out my website, and I have a lot of sleep tip and information on there. It's www.bhaisleephealth, all one word.com. I'm also very active on Instagram, and the handle is High Sleep Health. So please check out there. I regularly give out sleep tips and information, and shoot me a message. I would love to hear from you.
That's wonderful. We really appreciate you for joining us today. Thank you so much. And thank you for your time.
Thank you, Amy. It was fun.
Wonderful. And thank you all for listening and tuning in today. Please check out Dr. Yuan's information. Go to her Instagram page, go to bhaisleephealth.com, check her out. Please keep in touch with her, because she is a wealth of information. I've gone through her website, looked at the tips. It's great information. So Thank you again for joining us. We will see you again in 2 weeks. We're skipping next week, but have a great couple weeks and we'll take care. Bye now.